Hi everyone, I'm Mackenzie, co-founder of NanoDropper. Alright, so most of us have used eye drops before, right? You tilt back your head, put the drop, and a little bit always trickles down your cheek. Well, that's because those drops are too big. Our team first learned about this problem through an article titled, "Drug Companies Make Eye Drops Too Big, and You Pay for the Waste." We were infuriated. It turns out these drops are 5 times too big for the human eye. And with expensive prescriptions like those for glaucoma, costing up to $500 per bottle, this waste is contributing to a significant and devastating financial barrier to care for patients. To make things worse, 1 in 4 of these individuals chronically run out of their prescriptions before insurance will cover their next refill. We call this bottle exhaustion, and it is putting millions of people at the pharmacy counter every month having to either pay hundreds of dollars out of pocket to refill their prescriptions or forego vision-saving medications. As our team began investigating this issue, we started receiving stories from patients and caregivers who struggled to afford their medication. One that really stuck with us was from a gentleman named Richard. Richard shared with us his late mother's story, who, after being diagnosed with glaucoma, spent the last years and even days of her life up until her passing in constant fear that she had run out of her eye drops. This is no way to live and certainly no way to die. And Richard's mom is not alone. We have received countless stories from individuals who cannot afford their medications and who are running out before insurance will cover their next refills, forced to sacrifice their vision. And these stories are representative of the millions of Americans who are overpaying for their eye drop treatments, especially the 2.4 million Americans who have difficulty affording their glaucoma medications because they are either inadequately insured or encounter bottle exhaustion. But what these numbers don't capture are who these people are. And tragically, glaucoma affects some of our most vulnerable patient populations, including the elderly and patients of Black and Latin descent, who are 4 times more likely to develop glaucoma and up to 15 times more likely to go blind from this disease. So now you might be asking yourself why. There has to be a reason these drops are too big, right? No. In fact, decades of clinical research have shown that smaller drops are not only as effective, but in fact safer than larger drops, because they minimize the systemic side effects that occur when these oversized drops are absorbed by the TMS. But this is where we saw our opportunity. Our solution is the NanoDropper, a simple and elegant attachment for eye drop bottles that twists onto any standard bottle and reduces the drop to something your eye can actually absorb. By making these drops a quarter of the size, we can make 1 bottle of medication last up to 4 times as long, meaning that with an affordable $15 solution, we can save patients and payers an average of $2,500 per year per prescription and ensure that nobody has to fear running out of their medications again. While Richard's mom couldn't benefit from our solution, we want to ensure that millions of others will, which is why we are distributing directly to the source, to the eye care professionals that are already helping these patients manage their vision. Once in the clinic, we will have access to patients with a broad spectrum of eye health needs, who can also purchase from our website or pick us up from one of our retail partners. Additionally, we are partnering with large hospitals and institutions to ensure that patients at every step of our healthcare system can stop overpaying for eye drops, maintain their vision, and refocus on what really matters. To ensure our ability to execute on this mission, we have a core team of 4 co-founders with diverse and valuable backgrounds in science, engineering, and management. And we are unified by our shared mission to combat health inequity through innovation. 2020 is a big year for us, because not only will we be distributing the first NanoDroppers next month, but 2020 is the year that 80 million people will be diagnosed with glaucoma. And we want to be there to ensure that nobody has to choose between financial stability and their vision. So while our drops are small, our vision is big. And we are thrilled to invite you to join us on our mission to reduce cost, increase access, and promote eye health. 1 drop at a time. Thank you so much.